than giving one of these presentations than hearing your own bio. So thank you for that, Joy, Kevin. I appreciate that. Preston Miller here. I'm a senior HR leader here at Houston Methodist Hospital here in the medical center, which clearly I am not this evening. Thank you for letting me join you from Casa de la Miller. So we're going to go through the incredibly exciting topic, if you will, tonight of compliance, privacy, business practices in that sense. So this is going to be riveting. So I need y'all to get ready as we are on a 3.5-hour journey of talking about compliance. All right, let me get my screen shared and we will rock and roll. All right, hopefully you guys should see the screen right now. For some reason you don't, let me know. And excited to be able to be again with you guys here tonight. So really, as I kind of mentioned, we're not going to be here for 2.5 hours or 3.5. This is a great topic, but it's also one of those topics where this 16 questions. So I got 27 slides for 16 questions. I very much recognize that this is not one of the major portions of the class, or excuse me, of the test. And so what I want to try to do is help make sure that I give you guys the high level focus areas, the high level things that you guys can kind of focus in on, really try to hit those high points. And we will try to get you guys out of here incredibly early this evening so that you guys can go enjoy your families in the nice fall weather and various other things. So that's kind of our rough plan. Let me go ahead and kind of get us started here. First and foremost, the focus thing that I always try to do so I got my certification. I was blessed to do that in this last summer. So I was the idiot that tried to do it right in the middle of kind of COVID surge and various other things. And thankfully I passed. Really the focus area in this space is just focusing on what are the keywords, right? You're going to memorize and go through all these different sections for, I don't know, 6 or 8, 9 different sections within the test. And so each one of those is going to have a buzzword. So here's one big trick of the trade that if you haven't learned already, is that each question is going to have a buzzword, and know those buzzwords, right? So if it's talking about integrity or mission before personal gains or mission over margin or positive reflections of your profession, those kind of words, it should immediately click in your brain that you're talking about professionalism and ethics. And then you should kind of start pulling through that Rolodex of information that you have. And same thing with finance, same thing with governance, same thing with all these other sections. Focus in on the key words that are driving you to the section that they're talking about. Rarely are there ever questions that are kind of cross multiple sections and at the same time from a from a content perspective. So really focusing on that is going to be key for you guys. Again, this is 16 questions. So we're going to focus on all these things listed here. Again, I'm not going to read that to you, but this is about professionalism and ethics as an organization, the American College of Healthcare Executives. As you can imagine, it's a pretty big deal for them to make sure that their constituents and their fellows and their people that are part of their chapter are highly professional and highly ethical people. So this is a big chapter, but what I want to really give you some insights into, it's not difficult. And this is focusing on kind of the high level content, the high level ideas, and you want to make sure that you guys are kind of focusing on those core things to make sure that you guys are focusing in on that. But this is not difficult. This should be an easy 16 questions, 8% of your test that you guys are able to ace and be able to focus on some of these other areas that, as we all know, we struggle with for different reasons, right? So we're going to focus on all those things. These are the big focus areas here: patient rights, personal codes of ethical behavior, ethics committees. When you have spiritual diversity and diversity and those kind of topics, you'll get a little bit of that in the HR section, but you're going to get most of it here because it's considered an ethical standard and a moral standard to be able to treat everyone the same way. So you're going to get both spiritual diversity and some diversity kind of stuff here, as well as conflict of interest. Again, these are things that you guys need to be able to ace. So these are going to be our 4 major sections that are going to kind of drive us for the next little bit. And we're going to kind of walk through each one of these, starting with the ACHE's Code of Ethics. I want to be, if you guys are writing down and marking things for your test, star this, underline it, highlight it. This is going to be one of those sections that will be on the test. By God, if you're going to have a professional society that's going to give you a test and they have a code of ethics, and one of the sections on the test is about ethics, guess what? A lot of it's going to be in there. So you need to go through and read this. My suggestion isn't to memorize it, isn't to go through that whole situation of kind of trying to totally be able to recite it by heart. The focus should be is focusing on these 6 kind of big ideas, which we're going to walk through. But I would encourage you to read it and read it regularly. And, I don't know about how you guys study. For me personally, I'll always study and then I'll kind of create like these are the big topics. Okay, check. I have this one. I have this one. I have this one. Ooh, but maybe this one's not maybe I'm not as good at this one. And I'll add that to kind of my like last minute study notes. So I always kind of create like a 1-pager last minute study notes. For me personally, I had last minute study notes and then I just reread this code of ethics right before I walked in the door, right? It's simple. It's 2 pages. It's really simple. It helps frame the mindset. And it also is at least 2 to 3 of those 16 questions to help make sure that they are kind of drilled into you. And so continue to kind of focus in on that. So first and foremost, code of ethics. So this is the code of ethics really related to the profession of healthcare management. So they're going to expect that your professional activities represent honesty and respect and good faith, that it complies with laws and regulations, that it avoids personal gains from personal relationships, right? That you're not going to create conflicts of interest or create situations that create kind of shadows of doubt into kind of your ethical behavior. That you're going to focus on quality of care and avoid discriminatory practices, that you're going to focus on the risks of healthcare service and be mindful and knowledgeable about each one of these services so that you then, from a risk perspective, are aware of it and able to then kind of appropriately use that. As you can see, none of these are earth-shattering, right? So just need to know the language that's in this test or in these things to be able to do that. I'm going to have great faith before we even really get deep into this, is that if you have troubles in these areas from an ethical behavior, you probably wouldn't be here to begin with. So hopefully that is an understatement to be able to, that all these things are important within our environments. Next, so you have a code of ethics to the organization. So you have a commitment to the organization to provide healthcare services consistent with the resources, that you're not going to change the resources and modify them based off the type of people that you're serving. That when there are limited resources, which we none more have felt in these last 2 years, that you work through an allocation process of those resources. So staffing, so supplies, various other things that you're, even in times of great stress, you're still providing kind of as consistent and as high level of service as you possibly can. And then to our employees, right? To provide a safe work environment. We owe it to the minimum of our employees to be able to come into work and be able to leave work safely. Again, none more evident than this last year with COVID. And so we've got to then be able to kind of do that and then go through the appropriate grievance and appeals mechanisms. Last 2, I think, to community and society, meeting all the healthcare needs of the community. You got to remember one big thing, if you haven't heard this already from one of your other teachers, is that this is written from the mindset of kind of macro healthcare. So some of you might be in physician organizations, or you might be in for-profit, or you might be in kind of post-acute or pre-acute services, or any of those kind of things. You got to remember that the majority of healthcare in the nation is nonprofit acute care. So, or at least it was when all these kind of various tests and various other things were built. And so think about things from that macro, nonprofit acute care hospital. So yes, an acute care hospital, or excuse me, a for-profit hospital is absolutely going to focus on shareholder value and all those other financial means. But in this mindset, patients always come first, always, and they should in for-profit or not for-profit. But don't always think about kind of that nonprofit large healthcare environment. This, if you're gonna, this is the one comment that I can probably say is a guarantee to be on your test. So this is guaranteed 1 question. You got 15 questions down. Is that you as an ACH member if you have reasonable grounds to believe that somebody violated the code of ethics, you have a duty to communicate that to the ACHE. Every test course, the one test that I took, every test that I've heard people have taken always has this question. So it's an easy one. Guess what? You've already got one right. So if you are a part of the ACHE, you have a duty and a responsibility to report code of ethical report ethical concerns based off these code of ethics to the ACHE board and to the ACHE membership group. On top of all those other things, right? All those other areas were based off the code of ethics for ACHE. Many other groups have code of ethics for their individual societies. You are not going to be expected to know who these are, but what you need to know is that everyone is going to have kind of their own different sectors for their own code of ethics. They're going to have the Hippocratic Oath, obviously, American Nursing Association, physician assistants, medical society, right? There's hundreds and hundreds and hundreds in my HR societies. We have, each one has one and they're all different. So just, you need to know that they all have them and that everyone has kind of a duty to both their profession as well as the organization. And so sometimes those will be in conflict, right? You'll have an organization who maybe is doing something that could be deemed as unethical by your professional standards or vice versa. And so, the goal is to focus on and maximize both of those, not just the large organization as a whole. That's it. That's big number one. Easy done. Read through the ACHE Code of Ethics. Read through it. Super simple, right? This is the easiest thing you guys are going to be able to do and be able to kind of work through that. Next, patient rights and responsibilities. This is going to be huge for each one of you guys, and it's really driven by two moral philosophies. So sometimes I've heard these being on the test. In mine, I believe I had one of these and not the other. But obviously the test changes all the time, so I couldn't tell you whether that's going to be consistent or not. But one is kind of, and I'm going to start with the second one too. First is that deontology is that nature of duty and obligation. As a healthcare provider, we have a duty, we have an obligation to provide healthcare services. We have the responsibility to care for those that are in need. One of the biggest ways that we see this is through like EMTALA, through our emergency medical requirements, through our duty to act, through our Good Samaritan laws that you see, right? That if you have the ability to provide care, you should, because that's part of your profession. And then we have laws to protect those people if they feel like that they're doing the best thing in those cases. So deontology is really kind of the high level focus. And then the next is that utilitarianism that really says, what's the greatest good? There's, many, many, many situations, and each one of you guys could probably come to this, where there's kind of a no perfect solution, in a world or in an environment where we have life and death situations and situations where we are trying to determine what's the best good. And sometimes the greatest good is to have a celestial discharge, as we'll call it, or to provide resources to one group over another in terms of patient care. All those things are ethical dilemmas, but our focus has to be what's going to be the greatest good that is morally correct. And so these principles, as it said, the key word here is they should permeate your organization. You should feel comfortable and routinely that your organization is focused on these two things and not putting any two of these areas above anything else. And this, again, for the for-profit folks, will include kind of profits and finances, because this is a large part of kind of making sure that it's kind of that patients first mentality. So your policies, procedures, your mission statement saying that all of these resources are to be available and to kind of done in that way is incredibly important. So let's talk about some of these ethics committees. You will at least have one or two questions related to ethics committees. So we all get in situations where we have ethical dilemmas. Some of us might be a part of those more than others. You get a lot of those, especially if you're on the women's services areas where you have kind of fetal health, mom health, abortion issues. You sometimes get those at end of life issues in terms of vegetative states and comas and various other things that just kind of naturally cause where where one patient or one primary stakeholder cannot kind of provide feedback for themselves. And how do you then balance that versus the voices that you can hear, trying to work through that. So every organization should have some version of an ethics committee. And I will tell you, a large organization like Houston Methodist, we probably have 10 of these ethics committees, or 15, depending on the situation. So one of the biggest examples of this is we have an ethics committee related to the vaccine mandate for the COVID vaccine, and working through that process for us to be able to have a consistent and centralized group that is working through the religious exemptions and the medical exemptions to ensure that we're providing a consistent standard. So that's a good example of why you might create some just-in-time kind of ethics committees for your groups. But here's what should be really important about your ethics committees: not just that you have them and that you use them, but these are the issues that are there. I will never forget that my question was, which group was left out of this ethics committee? It listed like 5, and it said I had to pick between one of the ones that were remaining of what was left out. And it ultimately was a patient. So it was kind of referring to that interdisciplinary, because that was one of those questions that it took me a hot second to kind of click on what it was trying to ask me. And for some reason, that question stuck out of my brain. So you're going to get questions around this. So first off and foremost, it needs to be interdisciplinary. So I'll just keep using the vaccine comment, or the vaccine committee. That's going to be medical professionals. That's going to be your spiritual care professionals. That's going to be your HR and your employee health professionals. That's going to be some operational professionals. You're going to create an interdisciplinary mindset to make sure that you're having a well-rounded, well-constructed idea. In patient care related issues, you're probably going to have some patient liaisons. You're probably going to have even some community representatives sometimes, depending on how your organization brings patients in the community into these situations. Legal, obviously, is usually a key driver in all of this as well. Sometimes even PR, to be able to determine kind of the public relations components of each of the decisions that are there. So interdisciplinary is huge. Next is these committees are consultative. These are not directive. These are not intended to as a whole. And again, for the purposes of the test, they're not intended to be kind of arbitrators where whatever their ruling is goes. They are intended to consult with. So they're intended to kind of say, hey, we've got this issue. What do you think? What does this group believe is the right answer? Now, if many ethics committees are incredibly well respected and have members of the committee that are incredibly well respected, so usually they are a little less consultative in nature, and they're usually pretty directive. But what I'll tell you from the core structure from an ACHE perspective is they are consultative. That they are, the intention is to kind of be able to quote unquote bounce things off of them and work through it. They also then are to educate and analyze. So they're to analyze all the factors involved, but they're also to educate all the parties involved to consistency and to make sure that there is a routine nature to how that's being done. And as we've already mentioned, there's a range of ethical issues that will come with that. So ethics committees is a big focus area because that's part of your organization's, even if that ethics committee, let's say perhaps makes a decision that is unfavorable, that process that has gone through that whole, even just the committee's formation in general, creates this sense that the organization as a whole is attempting to do the right thing, right? Positive intentions usually benefit you in sort of situations with negative outcomes. 2 examples of that, like the infant care review committee. So infants with threatening life conditions, we've kind of mentioned some of those. And then for any of you who are involved in research, this is something that you are well aware of is the Institutional Review Board. This is all about research. So this is how you not just do clinical research, but this is about how do you pass to make sure that the research being provided was done in a safe and effective and ethical manner, that the content and the structure related to that was set up in such a way that the research is valid. So an institutional review board, for any of you who deal in the research environment, you very well know is an incredibly important part of kind of your process and how you then build kind of your finalization, if you will, of your research projects. I'm gonna pause here and just kind of make a note, right? If you guys have questions, if you have anything, this is a whole lot easier for both me and y'all If you have questions, just send me a note in the chat, or just start talking. There's only 11 of us on the call, so it's kind of one of those things where we can just kind of go through and just kind of talk it out. But so just feel free to do that if you have anything that maybe I could re-clarify things on. But moving forward, next, patient rights. Again, you're going to have a question on this. There's no doubt about it. You're going to have a question on this. So first and foremost, these are the patient rights. These are the, I want to say 6 for some reason. In my mind, I was wanting to say 7, but I knew that wasn't right. These are the 6 core patient rights. You need to understand those so that you then can understand what the ethical ramifications are related to them. So one is that it's a patient right to receive complete and truthful information. So one of the biggest things here is related to how easily understood it can be. We all know that healthcare is full of more acronyms than I think there actual are words, that we use our own jargon that all of us who are living in this environment feel incredibly comfortable with. I'll never forget, we had a new employee who was coming from outside of healthcare, and somebody tried to find them like a dictionary, if you will, of all the healthcare acronyms. And they found one. It wasn't all inclusive, nor was it very accurate, but it was like 10 pages long. So we all know that we have these kind of acronyms. Our patients don't understand that. All they see is they trust that nurse, that physician, that respiratory therapist, that whoever that is in their room. And I'll tell you, that trust factor goes up infinitely if that person has a white lab coat on for some reason. So finding and making sure that we break it down as to all the different people that are involved. One of the other things I always like to remind people, it's not necessarily on the test, but just as you're going through this for your own learning and growth, is the average healthcare stay, a patient interacts with 30 to 35 different employees at any given moment. That's a lot of people to know who is what, right? And sometimes people don't even know what the difference is between a nurse and a respiratory therapist, or a radiology tech and a lab tech, right? There's people who aren't as invested in the healthcare market like we are. And so being that hyper explanatory kind of nature is incredibly important when we're dealing with patient rights. For those of you that are providing that inpatient care, it's like that whole concept of narrating your care, right? This is what we've got to do. Decisions regarding patient care. We're going to come back to patient consents, which is obviously huge in this. We're going to spend a couple of slides on that specifically because it's incredibly important. And then we have to be honest with them with financial issues. This is none more evident now than with the price transparency acts, with pharmaceuticals and inpatients and outpatient radiology. All those kind of various things play into this and are incredibly important to when you're looking at financial issues, and kind of making sure that that is a part of the discussion, which we all know is just infinitely made more complicated because of the insurance providers and billing and the charge rate that we've never actually charged because we all have discounted rates, so on and so forth. So patient has the right to be and participate in the healthcare decisions. Going back to some of those ethical issues, right? When the patient cannot participate, that creates an ethical issue. So they have to understand the risks, the benefits, the impact of them, the right to seek other opinions, the right to refuse care, the right to leave AMA or against medical advice. They have the right to be able to do all these things, and we have the right to, or they have the right to do that, and we have to honor that. We have the right to receive, patients have the right to receive respectful care. So not depending on their race, their ethnicity, their ability to pay, so on and so forth. They don't have to agree with the healthcare decisions that we provide, and then we still have to respect them for that. I know sometimes those can be some of the most difficult situations. And this obviously from a test perspective, maybe not as huge, but from a real life perspective is just massive, is this intention of that we have to extend this respect to our loved ones, to their loved ones. And we've got to make sure that those that are in the room receive the same type of communication, understanding, obviously assuming with patient consent, that we need to make sure that they are treated and cared for just in the same way, because those are the people that sometimes when the patient is in a less than optimal state, that they are the ones who are actually kind of driving and participating more in patient care than others. Moving on, obviously we talked about non-discrimination, right? Equality of access. You see Vizient and US News and World Report and various other kind of highly prominent kind of healthcare benchmarks, leapfrog of kind of grading healthcare institutions on the quality of access. So how do you treat people by race, creed, gender, sexual orientation, age, or disability, or various other things is incredibly important. Confidentiality, I'm hoping at this point that you guys have had your own organizations just beat you over the head with PHI and HIPAA and confidentiality. And then also I know this organization or the test has another whole process around kind of the legalities with the PHI. So I'm not going to dip into that, but confidentiality related to their treatment and their process, but then also the privacy of their information. And I will tell you, this is has been a question in the past around physical privacy. Sometimes it's not just, do we keep our PHI close and do we not share it and do we not talk about it in elevators and various other things. Sometimes it's the first thing that we do when we get a patient in the bed is we tell them to take all their clothes off, put on this really thin robe, and then we're going to start poking and prodding you, right? So finding a way to do that in a respectful and a private manner that still allows that patient to receive dignity. That still allows that patient to still do all those things because we need it, but do it in such a way where that's the right that they have to not kind of be just stripped and publicly displayed in front of the world. There's nothing worse than somebody has that gown on and their butt cheeks are just flapping in the wind, and for all to see, and that patient doesn't want it or doesn't even realize it. It's a thing. So they deserve that privacy. Moving on. We, as an organization, have certain responsibilities that we expect of the patient. And so whereas they have these six, or their six kind of patient response, or excuse me, we have our six responsibilities. They, the patient, have four responsibilities for us. So first and foremost is full disclosure. We've got to know their full medical history. We've got to know their, are they on non-therapeutic behaviors? I thought that was a very positive term for drug, alcohol abuse, self-massification, all that other kind of stuff that just comes along with some terrible behaviors that sometimes our patients experience and then go through. Non-compliance. Are they in the ER because they haven't taken their blood pressure medication in 3 months, yet they tell us that they have, right? Well, the answer to that question of have you taken your blood pressure medication is our response is very different depending on what they say. And so we are expected and owed the responsibility to make sure that they are disclosing the fullest of information possible. Compliance. If we're going to create a treatment plan and agree to it with their buy-in, because remember, they are part of the participatory plan for their plan of care. If we agree to it and they don't comply, that's obviously against the patient rights and responsibilities. And then the failure to report any barriers to compliance is important there. Maximize health habits. Not all of us, myself included, sometimes have the most positive health habits. And so, but that is a patient responsibility to maximize that so that they are obviously providing the greatest level of health possibilities and highly positive environment for positive health outcomes. And then lastly, is financial obligations. We know that this isn't always met, but it's one of those things where while it is our duty to provide care to those in need. When we do provide care, we realize there's a cost to that, and it is the expectation of our patients to be able to meet those financial obligations. Patient rights. All right, so let's go back to patient consent. Have this. Let me see if this is on the next slide or not. Nope. Okay. So elements of consent. So first off and foremost, the element is the diagnosis, right? That has to be part of it. Explain the procedure, the risks and benefits of the procedure, alternatives, risk and benefits of alternatives, including doing nothing. Do you have any questions? Any information as a reasonable person would want to know, right? This is basics. What we have unfortunately done in healthcare, because of unfortunately the highly litigious nature of healthcare environment, is we have downgraded this incredibly important patient consent process to a piece of paper that we throw in Epic that we expect them to do online. It's 35 pages long, and we expect them to agree to all of it. Now, obviously that's an over dramatic dramatization, but it's a situation where we have to really reinvigorate ourselves with the consent. And as you are going through this test, you've got to remember that the test is focused on the this in its most purest and most philosophical and metaphorical form, because that is where obviously the content of this is coming from. So first off and foremost, the patient consent is not a piece of paper. We document the conversation on a piece of paper, but the patient consent is a two-way, multi-collaborative, multi-person dialogue and verbal consent and discussion, right? This is not a situation where they're just expected to sign a sheet of paper that has 6 consents. You consent for this implant, you consent for this ortho procedure, you consent for anesthesia, all of those things are important, but where's the dialogue in all that? This also has to go to our physicians and our staff as they walk in. And I'll never forget, one time I was having surgery, minor surgery, and I never met the anesthesiologist before, not that I really needed to. They were in my room and out in 10 seconds, and that was their consent. Not that that's, I had trust and faith in both my primary surgeon as well as the rest of the facility, but it was also a situation where that in that environment where maybe I wasn't as comfortable, that's not great. So it can't just be a piece of paper. It has to be a verbal dialogue discussion. And each one of these things needs to be discussed. Risks and benefits of a procedure. You're not going to put all that on a piece of paper, but what you're going to do is you're going to talk about it. If you're going to have knee replacement surgery, there is a chance that X, Y, or Z could happen, making it difficult for you to do X, Y, and Z. And now let's talk about it. So, but here's the benefits of it, right? That's that two-way dialogue that we have to have. And this bottom question of any information that a reasonable person would want to know is a pretty leading question for us. So this really talks about this idea of we have to be thinking like a patient to say, yes, we've done 1 through 6, but is there something special about this situation that causes us to need to pour into that a little bit more? And so that is incredibly important. So patient consent, for sure, you're going to get a couple of questions on that, if not one really good one. So you need to know both the elements and the why, probably behind all of those. All right, here we are. We're trucking, we're rocking and rolling. We're halfway done, and I'll tell you, we're probably more than halfway done, as we've got cultural and spiritual diversity coming up. So let's walk through that. This is a relatively short section, but you will guaranteed have a couple of questions on this. So as you can imagine, obviously there has always been racial unrest and racial sensitivity and just diversity and inclusion focus kind of in our nation, but I would say probably very few times is it more fever pitch than it is right now. And this is a huge focus of the ACHE, as well as it should be for every healthcare institution, not just to go through the motions and try to show that you're a diverse and equally inclusive organization, but to truly champion the cause of diversity. I will tell you, not just from this section, but also my HR hat and also my personal beliefs. This is a situation where we have hundreds of employees, thousands of employees potentially who operate together to be able to support our patients. And that is built on the success of having people with different thoughts, different backgrounds, different beliefs, different support systems, different structures within their lives. And without having that, we don't have as well-rounded of a team. Our community, we as an organization and we as an employer have to represent what our community both looks like, but also acts like and also feels. And I will tell you, especially in Houston, one of the most, if not the most diverse city in the entire nation, that is a large burden on us to make sure that we are focused on all of those things. Not just obviously racial equality, but this is religious equality and gender equality and sexual orientation and all the things that are a part of that. And so ACHE is huge in this, as you can imagine. So this is not just about as the employer, but this is also on patients. So we mentioned earlier, patients have the ability to receive equal care based off, regardless of their diversity demographics, if you will. And this is a situation where we've got to make sure that that is watched, standardized, reviewed, improved, So how do you provide culturally competent care? How do you ensure that a patient who has one set of ethnic beliefs receives the same level of care, but receives it in the way that they want as somebody else who has different beliefs? And tracking that and watching that. So much of this is really being built through diversity offices and diversity programs that are, their whole goal is to focus on top to bottom, employees, patients, kind of how diversity impacts their organization and kind of the care that they provide. So you see all this here. This is obviously a large a part of the process. I will tell you, this is going to be a question on the test. What I will also probably tell you is, if you have this DEI, we need to treat everyone equal from a healthcare provider, like we need to provide care to all those people in equal and appropriate and resource appropriate ways, then it should be an easy question for each one of you guys, because it's going to be real philosophical probably in that space. It's not going to be very granular or tactical. All right, last section. Who's buckled up and ready? We're almost there, guys. Here we go. We got 7 slides left. I know people are getting excited. All right, conflict of interest. So conflict of interest occurs when one has conflicting duties or responsibilities, and meeting them one makes it impossible to meet the other. How is that happen? If you have purchasing power over a different product, and yet you are the owner of that product, there is no possible way for you to have a mindset of fairness and equality when you're evaluating other products, because that is you have a vested interest. It's just not possible. When you have these ethical dilemmas and you have a vested interest in the outcome, you are clearly have that conflict of interest. What is probably more important, in my humble opinion, is, I think it's obvious, especially in these days of Enron and the various other, Ponzi schemes and various other things that are kind of create these kind of ethical dilemma, conflict of interest type formats. There are, for us, it's really more of that mindset of, how do we avoid the perception of having a conflict of interest? How do we avoid the perception from others that we could have a conflict of interest in any situation? Because even if it's not true, the perception thereof is incredibly hurtful and damaging to kind of both that person and the organization. So what you see is a lot of information here really related to that, those very tactical processes to both ensure there are no formal conflicts of interest, but then also kind of the processes in place to make sure that there truly is a line of demarcation there. So obviously one of the biggest places this comes from is, and this is all industries, as many of you know, is the Sarbanes-Oxley Act of 2002. This is the certification of the financial reports of both the CEO and the CFO. It really totally blew up the financial centers and the financial requirements for organizations, both nonprofit, for-profit. And so in these spaces, this change, this is obviously, again, all related to the Enron and so many other kind of companies that were kind of in this same space. So certification of financial reports, ban on personal loans, public reporting of CEO and CFO compensation. Your facilities are part of this too, is having your, especially as part of a nonprofit, the rules are slightly different, but it's also that those a lot of these conflict of interest reports are still pertaining to each one of that. Internal audits versus external audits and the need to do both. The encourage employees to report unethical behavior. Okay, this is a big one. How do your organization set up their business practice hotlines, their compliance emails? Typically every organization is going to have a code of ethics officer or a compliance officer or a business practices officer, something like that, where their, again, whole job is to create those steps to make sure that there is avoidance of any of conflict of interest form or conflict of interest, as well as just kind of watching the organization to be able to support its success really in these measures, but how your employees, patients are able to present out and provide out information related to kind of their concerns in both an anonymous and then highly tracked format is a huge part of Sarbanes-Oxley that everyone kind of on this call is impacted by, and you have to make sure that you kind of are aware of what that process is, and to kind of know that both for your organization, but then also for the test. So probably the biggest line in here is this bottom line: the continuous search for conflicts of interest within the organization. So there's this, not this just one-time situation. It's a continuous and a never-ending process to figure out where conflict of interest role. I know most organizations that I've been a leader in, I'd have to disclose both not only every year, but upon hire of any conflicts of interest and any other those things that could cause kind of a shade in my judgment, if you will, in that space. Here are types of conflict of interest. Be familiar with these for sure. So self-dealing, public or private interest collide. This is right where you own the company and the hiring decision. Poor thing. This would be outside employment. You are a consultant perhaps, and that then you are using that consultancy to steer business towards your primary employer, which is then would be against kind of that conflict of interest format. You have family interest. You have a family member who either owns a business or works for this organization that you would then choose to kind of have to do something with, or you're going to merger and acquisition people, or from an HR side, right? I mean, like you have a family member in the building that you're saying that we're not going to discipline or we're not going to let go because they're your family member. All that relates to conflict of interest. Gifts, how your organization determines gifts, how they, excuse me, what's acceptable, what's not acceptable, how much that value can be, how often that value can be, and knowing those employees with huge kind of influence over our vendors. I think about supply chain and some of our even HR and some of our high level leaders where they have influence over millions of dollars of decisions. Will guarantee you some of these outside vendors are going to want to be able to kind of wine and dine these folks as much as possible. And so there is obviously an appropriateness to that, and also an inappropriate nature to that. So being able to determine both is incredibly important, and knowing what each one of these types are and being able to kind of see where that conflict of interest will go will help you on both the test and then also kind of your career. Ways to mitigate conflicts of interest. Remove them, right? One of the biggest ways is just, if you have a conflict of interest, don't have them. Get rid of, divest in that organization, or don't employ your family or relatives. Disclose. So if I tell the world that I have a conflict of interest with this situation, then the world knows. And then I take the next step and I recuse myself, or I remove myself from any decision-making processes related to those people. As you can imagine in any organization, there's a fair amount of nepotism or family members that come in, right? And so anytime there's performance discussions or those kind of things, we always then make sure that those leaders are not included. This is also a big part of this. Imagine yourself as you have a, that's why typically there's a conflict of interest from a provider to a patient where there's a family relation there. To make sure that there is no longer that conflict of interest. Not that you would do harm to that patient, but there's no way for you to be one and not the other. So creating that separation is incredibly important. Determining that code of ethics and having that be a living and breathing document in your organization. But if you're going to get a question, in my humble opinion, it's really going to be about this. It's going to be about how have you built conflict of interest mindsets into your policies and procedures? How is it a integrated, and we'll use a word that we stole earlier, how does it permeate your organization to make sure that you are minimizing those conflict of interest situations? All right, buddies, that's it, my friends. So let me kind of go through high level stuff, right? So those are the big core questions related to professionalism and ethics. Let me kind of give you some high level, both test taking tips related to this section and others. Let me go back to where we started. Think about keywords. Think about kind of, if you hear integrity, ethics, compliance, all of those different areas, there's clearly a bend towards this section. So just pull that line up in your Rolodex and be able to work through it. I will tell you, I fully agree with the recommendations that are here of go through the entire exam and answer all the questions that you can. When you first sit down, it's a long, I mean, it's 4 hours if you take the entire time. It's nuts. So go through it and just get the easy ones out of the way. Get the ones that you, without a doubt, no questions asked. First time you went through it, you know the answer and kind of work your way through it. And just skip those that aren't. Don't get bogged down by it. Sometimes, I will tell you from a test taking perspective, you just gotta get in the rhythm. You just kind of got to say, okay, I got this question, I got this question, I got this question. And that kind of helps trigger your mind to think about some of the others. Once you finished, go back and answer the question that you skipped. These last two are huge. You're going to get situations where you're going to have two answers that seem right. That's just the nature of how it is. So first off, get it to two answers. Get it to a situation where you're eliminating as many bad choices as you can. If you can't eliminate bad choices, either skip it or look for one of those all of the above type formats. Use the process of elimination, but then always choose the highest level answer. So what are the highest level answers? Integrity, compassion, patient rights, highest level of patient care. All those things are going to be related to the highest level answer and the most all-inclusive to make sure that you are successful in that space. While you are in that room, you are going through many, many, many different topics. And so I just highly encourage you guys to really look through your notes, look through your books, but take your time, right? This is it's a hard test. There's no doubt about that. And you're taking huge steps by taking a class like this. What I also say is, you know the information. So when you've got kind of work-related knowledge about a topic, use it and roll with it. But think about everything in its much more highest level, philosophical, highest end answer, rather than trying to say, "Ooh, this is how we do it." Not that the way you do it is wrong, but the way that the organization is set it up in a perfect world scenario. So think about all these questions in a perfect world scenario, and don't pick them apart with what we all know is the complexities of reality. So I studied, or I took up again, passed last summer, I guess 2020. Yep. And so here was kind of my study behaviors. Again, I'm only sharing these to just try to help you guys all pass, because that's what we want. So I did go to a course review seminar, but I did that almost at the beginning of my kind of study versus at the end. So I used it almost more as a foundational component to just kind of be like, okay, these are the things I need to focus on. And I tried to kind of find my weaker areas there. And then I went through my core weak areas to try to figure those out. I will tell you, in the last probably 6 to 8 weeks before I did it, I found that they had flashcards. Most people don't work with flashcards. I typically don't work with flashcards because that's not typically my style. But what was really helpful for that is that it came with an app that came along with it. And so I had 10 minutes in between a meeting, and I had nothing going on, or I had enough that I wanted to kind of do that as opposed to something else. And I just go through and answer a couple of questions, right? And just that repetition and those things were fantastically helpful for me. Not necessarily that it taught me those keywords or those structures. It helped me define my Rolodex in my brain. It helped me say, this question, I need to pull from that information. This is a governance question, I need to pull from that information. This is an HR question, I need to pull from that. So the flashcards were very, very helpful for me. And then, as I said before, my style is, there's things that you just either already know or that you kind of have been able to learn relatively easily. And there's things that just you don't. And so those things that I didn't, I would just make kind of a cheat sheet. And then when I'd learn all that cheat sheet, then I'd go back and say, okay, what are the things I still need to learn? And I'd make a new one. And that last minute before I'm walking into that test, I read the Code of Ethics handbook just one more time. Again, it's 2 pages. So it wasn't like it was this incredible review, just to kind of refresh myself on the language, mainly because this wasn't a section that I studied very much. And I went through kind of my last minute notes just to kind of put things top of mind. But each one of you guys are going to do great. Have confidence in yourself to be able to do this. You are high level professionals. Otherwise you wouldn't even be thinking about this, let alone actually prepping for it. And I just wish you nothing but the biggest success. So here's kind of some of the conclusion kind of stuff to kind of know. But with that, I'm happy to stop sharing, answer any questions that you guys might have, whether through the chat or virtual, or give y'all an easy breezy night, whichever's up to y'all.
All right, Preston, thank you very much. Great job as always. Any questions for Preston before we let him go? I don't see anything in the chat at this time.
All right, friends, good luck to y'all. I appreciate you guys. I know this is hard, so proud of y'all for taking this step. I will tell you, it is one of the most rewarding things that I've done to be able to show that I'm, you know, I know each one of you guys have your story, but to show that I'm much more than an HR person. I'm a healthcare exec kind of in that space. So I am excited for you all. And if I can help y'all in any way, I hope our paths meet in the future. Thanks, Kevin, as always. Appreciate you.
Thank you, sir. Thanks, everybody. Have a good night.